member Orapu College of Scholars. Charity is a certified dental therapist with a postgraduate diploma in education. She has worked with Purdue College of Health, Ogun State, and she served as the head of department and a tutor in 3 departments. Currently, she runs a personal online store, Chinese stores, and she's scouting for other opportunities. She is also the finance officer of the Orapu College of Scholars. Charity will be talking to us on how to give an effective oral health instructions. You're welcome, Charity. You have the floor now. Charity, we can barely pick what you are saying. Please check if you need to unmute yourself.
Thank you very much, the moderator. Thank you very much, our lead mentor, for this opportunity. Thank you very much, and to the members of Oracle College of Scholars and to our distinguished audience. As has been rightly introduced, my name is Chika Charity. I'm here to give us the topic, how to give an effective oral hygiene instruction. As has been rightly introduced, let's walk down to the outline for today's presentation. We have our introduction, oral health promotion, oral health promotion through Ottawa Charter, how to give an effective oral hygiene instruction, what to keep in mind in preparation of an effective oral hygiene instruction, conclusion and references. Oral hygiene instruction is a helpful and educational information designed to educate and guide the society to prevent new cavity and to maintain a healthy teeth and gum. It is an intervention program aimed at impacting knowledge on the causes of diseases, decay of the teeth and periodontium, possibilities of disease prevention and adequate treatment, essence of proper nutrition, regular and proper oral hygiene, use of fluoride, as well as significance of regular checkups with the dentist. Communication plays a vital role in community empowerment and health promotion. The goal of health promotion is to improve and to increase the health literacy of the population or the patient or a group of persons to which is being addressed to by acquiring basic skills.
Ms. Chika, please, could you increase the intensity of your voice? We can barely pick what you're saying.
My apologies on that. Okay, the goal of health promotion is to increase health literacy by acquiring basic knowledge, skills, and attitude needed for good oral hygiene. According to C et al. 2001, oral health education is a key element in the prevention of oral diseases and promotion of oral health. Oral health education is the transfer of new skills to an individual or group of persons with focus on behavior, and conditions that promote oral health or reduces the risk of oral diseases. Is the transfer of new skills. After giving out an oral health education and the skill is not being picked by your audience, oral health education has not happened. Oral health knowledge cannot lead to a desirable health behavior. Rather, it empowers the population with the right information, enabling them to take action to protect their health. The implementation of oral health promotion has two aspects: the provider and the individual or group. The provider, which is the dental health practitioner, the dentist, the dental therapist, the dental surgery technician, the dental nurses, and public health practitioners. And then the individual or the group of persons to which it is being addressed to. According to World Health Organization 2007, oral health is an important component of general health, essential for well-being. Majority of oral diseases are related to lifestyle, and reducing these diseases rely more on behavior. Changes in behavior require treatment and action. After giving out an oral health education, it is now on to participants, the audience, to change positively their behavior and their actions towards their oral health. Oral health promotion is a combination of oral health education, legal, fiscal, economic, environmental, organizational, and technical interventions designed to facilitate oral health and prevent diseases. Health promotion program achieve success through actions, the determinants of health. To educate, to educate means to improve the level of an individual's learning and the ability to change. This development should be based on the knowledge of reality and the thought process of each subject. There are two aspects to educational process: the perception and motivation of the receiver. How do my audience perceive this program? What is their motivation? When you don't change their perception towards the oral health education given, there will not the desired change will not be achieved. So it is advisable that the perception of our audience, of the population, needs to be changed for us to get a desired result. The association of these aspects encourages the change of individual behavior and makes them responsible for their own health. The most widely used method of promoting oral health are verbal and reading advice. Verbal advice in terms of presentation, oral health promotion through social medias, and the rest of it. And the written advice can come in form of pamphlets, flyers, posters, which can be seen in our doorposts. It can be seen in a dental clinic. It can be given out on the way, or it can be given to school children. These methods are effective for increasing patient knowledge regarding oral health. Oral health according to our Ottawa Charter. The Ottawa Charter was developed by the World Health Organization 1986 as a framework for constructing health promotion programs that address the wider determinants of health. It forms a strong base for oral health promotion. Three principles are taken into consideration while planning public health programs, which are partnership, participation, and protection. For oral health practitioners or public health officers, we have to partner with necessary bodies for us to achieve our desired results. We have to participate effectively and to encourage our population, our audience, to participate effectively for a desired oral health education program. And protection, we should be able to protect the interest of our audience and the population. The Ottawa Charter suggests that the program be built around the following 5 actions: building public health policies in all sectors and not just health sectors, creating supportive environments, strengthening community action, developing personal skills, reorienting health services in terms of taking away the services from treatment and curative to prevention. How to give an effective oral hygiene instruction. As an oral health caregiver, as a dentist, as a dental therapist, as a dental surgery technician, as a public health officer, it is expected that before we give an oral hygiene instruction, we should introduce ourselves. You do not just come to an environment or come to a place and start talking to them about their oral health without introducing yourself. Introduction gives room for the audience to accept you and to create a rapport between you and your audience. It helps the audience to feel at home, to feel relaxed. Yes, I know who is talking. Yeah, I can trace this person. A kind of feeling that, okay, this person, I know the name. Someone can meet you tomorrow and say, yes, I know this person. This person has spoken to us on a particular topic. So introduction of your name, your place of work, your purpose should be met first. Then you can start with a comic or a comic or an example or a short play before introducing your topic. You can decide to introduce something that will make everyone laugh and giggle, and you create an environment where the atmosphere is lively before you now introduce the topic. Then introduction of your topic, emphasis should be laid on oral cavity and its structures. You talk to them about oral cavity, the gateway to the body, then the structures of the mouth, help them explain and identify the structures of the mouth, such as the tongue, the teeth, the palate, the salivary gland, the masticatory muscles, and all of that. It's just a brief introduction of oral cavity. Then you educate your audience on common oral health diseases and risk factors. You talk to them about common oral health diseases. You mustn't mention everything. Even if you mention everything, but make sure you specify or you emphasize on 2 or 3 because of the time of the presentation. You educate them on the relationship between oral and general health. Educate on oral hygiene materials such as toothbrushes, floss, chewing stick, dentifrice, mouthwash, tongue cleaner, interdental brush, using visual and teaching aids. So when you're educating them on toothbrush, you show them, you go along with it. Make sure you give it out to them. Make sure you show them how it is being used. Educate them properly on these oral hygiene materials, because most of them have not seen it before. Most of them are just getting to know about it. Most of them are just getting to, feel it, to touch it. Okay, especially floss. Toothbrushes may not be so common in some areas, and dental floss. Most of the communities, most of the groups uses chewing stick. They've not come and they've heard about toothbrushes, but they may not have seen it. So it's advisable that we go along with toothbrushes, floss pick, chewing stick, dentifrice, mouthwash to enable the audience to be able to identify it. Educate and demonstrate on use and frequency, duration, and care of these oral hygiene materials. You take your time to educate them on the toothbrush, how to use it, the frequency, the duration, when and when to discard it. The same thing with floss, how to use a floss pick, how to floss, and how to dispose it after using. For those that use chewing stick, you take your time to explain to them on how effectively they can use the chewing stick to remove deposits, to clean their teeth, to clean the surfaces of their teeth, and also introduce them to the use of dentifrice, how it fights against dental caries and other diseases. So you have to educate and demonstrate on method of each of them for effective assimilation. Educate your population or audience on the diet and self-cleansing food, the adequate diet that is required for them. Yes, our society is hinged on carbohydrates, carbohydrates, food, and all of that. You explain to your audience the importance of balancing our diet and self-cleansing fruits, which is very, very important to enable them to maintain a good oral hygiene. Educate on bad oral habits, which some of them practice. Educate them on the bad oral habits and how to stop it. Educate on best places to seek dental advice and not just to go to someone that have little or no idea about it. The best place to seek a dental advice, if they are in a remote place, you can give them a phone number to call. You can share them with, you can educate their primary healthcare provider on the necessary things. So when they have an issue, they can resort to the primary healthcare provider, and the primary healthcare provider, for cases she cannot handle, will refer down to you. Then you educate them on the importance of regular visits and professional teeth cleaning. Conclusion, then you entertain questions and feedback. Question is very, very important when giving out oral hygiene instruction. Oral hygiene instruction is not complete without entertaining questions. It helps to clarify points and salient issues regarding patients' oral health, and patients feel at ease when questions are being answered. What to have in mind in preparation of an effective oral hygiene instruction? What are we supposed to have in mind as an oral health care provider, as a public health officer? What should we have in mind in order to give effectively oral hygiene instruction? Firstly, informed consent. You cannot come to a community and you pack your bags, you just put your bag down and you start speaking to people, or you start gathering crowd. Come, let me give you oral hygiene instruction and all of that. No, it's wrong. You have to take due process. There are processes to a thing, and that is informing the head of the community, informing appropriate bodies, the head of the youth, the so many heads in the community. You meet with them ahead of time, even before the date of the scheduled appointment. So you don't just come to a community and start giving oral health education. No, you have to go before time, make inquiries about who and who to meet, who and who not to meet, then talk to them about your desire, your plan, and when it's been approved, you can go ahead and continue with your program. The second one is planning, partnership, and collaborations of NGOs, governmental organizations, private and individual firms. You plan and partner with organizations. There are governmental organizations that are ready to foot the bills, they are ready to support the program. Even individuals, even in the community, the village head might decide to, okay, this is a very beautiful program, this is a very beautiful opportunity, we would like to do this, is there any way we can do this? This comes with adequate planning and partnership. You can't do it alone. Oral health education is not a sole business. It's not a one-man business. You can't do it. It involves partnership with group of persons and the community, or the group of the community which the program is being disseminated to. You can also get funds, you can also get support and materials from organizations, private and individuals. Some persons may decide to give you money. Some persons may decide to give you materials like Colgate, Orabi, all these toothbrushes, toothbrush companies, toothpaste companies can decide to support your program. So you reach out to them, talk to them about your plan, let them know, let them see the desire, let them know what you have in mind, and you will see them supporting you. Then you have to have a confidence, and your communication skill will have to be top notch, because speaking to them, you have to be knowledgeable about what you will talk to them about. You have to be confident of yourself and what you came to deliver. Then simplicity of the instruction, both reading and verbal. Your instructional material should be simple and straight to the point. It shouldn't be bogus. It shouldn't contain words that are unfamiliar to them. You know, you're speaking to a layman, you should bring it down to their knowledge so that they'll be able to understand what exactly you are talking about. and for them to able to follow you. So your materials, both verbal and reading, should be simple for a layman to understand. Then a mini research about the clinic or the community or the population you're about to um, educate. You can research about their age. What are the age group of these persons? Am I going to a school for an intervention program? What are the age group of these schools? Am I going to talk to all the students? Am I going to talk to only nursery school students? Am I going to talk to primary school, secondary school, tertiary, university? Or am I talking to a community where there are educated ones? Am I talking to community where there are non-educated persons? Am I talking to people that are rich and classy, high socioeconomic people? Am I talking to people that speaks English? These are what you consider. You have to research about those people you are, or the population that you are reaching out to. Research about them. Have basic knowledge about them, what they do and all of that. It will help you in planning. It will help you in the planning of the oral health educational program. Then you have to state the objective and the goal of the program. The reason why we state it is so that it will help us in our evaluation to be able to note if the reason for the program has been achieved, if the goal has actually been achieved for the program. Then what we have in mind still continues. We talk about community participation, support through monitoring. The community, maybe after informing the head of the leader, they'll say, okay, we are going to support you on that day. Maybe we will tell our community people to bring chairs to a particular venue. They are willing to support you, they are willing to participate, they are willing to help you out to bring this desire, because they are so excited to receive the news. They are so excited because some of them may be the first time it is coming to their community. They are so excited to receive it, and so they are willing and ready to support you in any way. Then your speed of speech should also be noted. You shouldn't be too fast, too slow, or you should just be normal. Okay, so because there are persons that do not grab words that easily. So when you're speaking to them, you have to take it gently, but not too slow. Then you have to manage your time very well. Then you consider the language of the people and you motivate them with gifts. Go along with materials, go along with toothbrushes, give it to them free of charge. Go along with toothpaste, go along with dental floss and other oral hygiene materials. Give it to them. It will help motivate them. It will help them to take really actions, because some of them may be giving reason, I do not have money to get this. Support them by giving them gifts at the end of the instruction. Then you can take your evaluation by meeting one or two people. How did you see this service? Do you think we can come back? You get feedback from them to be able to evaluate the program. In conclude, educating patients and a group of people on the importance of oral hygiene and helping them understand how it can affect their overall health plays a significant role in their perception and the value of service. It is our duty as oral health practitioners to make this happen, having in mind that prevention of a disease is less costly and affordable than its treatment, and can be achieved by adequate planning, practice, and execution. The references are here. Thank you very much for listening. Thank you very much for listening.
Okay, thank you so much, Ngwu Charity Chika, for that wonderful presentation. I believe we all enjoyed your presentation. I did.